Now, Leslie McCormick of the Farwell Group, author of Bank on Yourself, Why Every Woman Should Plan to Be Financially Single Even If She's Not, joins us. Good morning, Leslie.
Good morning, Marilyn.
So you talked about many things, but last time you said you were going to talk about affording our healthcare costs. So let's get to it.
Sounds good. This year, we have a project that we're working on with our clients called What If? And it starts by asking the question, what are the circumstances that might impact your financial future? Not really surprising, one of the main topics that comes to people's minds that they want to talk about is a question of health. What happens if they require expensive care? What happens if they need long-term care? It's an important question. Healthcare costs for those who need it can be very expensive. Affording the quality and type of care you want takes planning. The conversations we have are including discussions like, what is your family situation? Some people have the benefit of close family who would be willing and able to provide some level of support. Other people don't. Who would act as your power of attorney for finances or for personal care if you don't have someone able, willing, or that you feel you can rely on? What are your options? Because there are options out there. What's the level of spending in retirement? If someone's planning and able to afford a high level of spending throughout their retirement, most likely their budget can absorb some of these costs, as typically when you have to spend a lot of money on health expenses, you aren't spending them on other discretionary items. For someone spending a more average amount, we need to discuss, would there be enough cash flow to generate, to be able to cover the cost of care? What are your potential backup plans? If expensive care is required and there aren't enough liquid assets to provide the income needed, what are other assets we might be able to utilize, and what would that look like? Do we have a gap? What are the strategies out there to fill a gap if one is identified? And again, there are some strategies available. A big issue for couples on the healthcare front is, what if one of you requires care but the other is healthy? How do you do both? Afford the quality of care needed for one, but also maintain the standard of living for the other. How would this scenario financially impact an eventual survivorship scenario? Marilyn, you've heard me say it before. We want to plan happy, healthy, active to at least 95. But proper planning makes sure we also ask the what if questions. What is your backup plan? Are you comfortable with whatever that plan may be? Or do we have a gap? And if we have a gap, what are the options? And how do you protect yourself and your family? By identifying these issues and talking them through before they even become a problem, identifying strategies, and if needed, putting contingencies in place, it provides peace of mind that you and your family will be okay, so you can retire comfortably with confidence in your financial well-being.
Wow, Leslie, everything you say makes sense.